Somewhere inside this textbook is a treatment for tetanus. Not a vaccine, not an antitoxin, not intensive care. A few drops of medicated oil placed inside the nose. Somewhere else in this same textbook is a medical idea that once helped kill one of the most famous people in history. We'll come back to that. Because before we get there, the textbook asks us to accept something even more fundamental, that diseases as different as asthma, psoriasis and type 2 diabetes can all be treated by deliberately inducing vomiting. Welcome to the fantasy-filled world of Panchakarma. 5 procedures taught to every Ayurvedic student in India as part of the national curriculum. Therapeutic vomiting, purgation, enemas, nasal therapy and bloodletting. Their origins lie in a world that knew nothing of bacteria, hormones, immunity or cells. Yet, this is taught in textbooks every year to thousands of students even today. In the previous episode, we looked at the ideas that form its foundation, the 3 doshas, ama, and the belief that disease begins when all these invisible forces fall out of balance. This time, I wanted to do something different. Rather than discussing philosophy, let us do what every medical student is expected to do. Open the textbook and read what it claims. And ask a simple question. If we compare these explanations with everything we have learned about the human body over the last 2 centuries, do they still make sense? Let us begin with the first procedure. The textbook starts with Vamana or therapeutic vomiting. This is not vomiting to remove spoiled food or relieve nausea. It is presented as a therapeutic procedure for eliminating what Ayurveda calls vitiated kapha. And the textbook recommends it not only for illness, but in some circumstances for healthy people as a preventive measure. That immediately raises an obvious question. How is making someone vomit supposed to treat diseases elsewhere in the body? The textbook answers that with an analogy. Imagine a paddy field. Cut off the water at its source and eventually the entire field dries up. Likewise, the stomach is described as the source of kapha. Remove kapha from the stomach through vomiting and the excess kapha throughout the body disappears. Okay, let me try to debunk the analogy using another analogy. Just because your apartment gets water from an overhead tank, does cleaning the tank somehow repair every leaking tap in the building? Or think about your home's electrical wiring. If the main switch trips, every room goes dark. That is because every room is genuinely connected to that switch. Now imagine someone saying that restarting your Wi-Fi router should also fix a leaking tap in your bathroom. Both problems exist in the same house, but they aren't connected in a way that the analogy assumes. Analogies are nice, but an analogy is only a starting point. It must eventually be supported by evidence showing that the proposed mechanism reflects what actually happens inside the body. That step never comes in the book. Vamana is recommended for asthma, chronic bronchitis, psoriasis, hypothyroidism, and type 2 diabetes. These are fundamentally different diseases. Asthma is an inflammatory disease of the airways. Psoriasis is an autoimmune disorder of the skin. Hypothyroidism results from inadequate thyroid hormone production, while type 2 diabetes is a metabolic disorder driven largely by insulin resistance. They affect different organs, arise through different biological mechanisms, and require different treatments. The chapter never explains how emptying the stomach influences inflammation in the lungs, thyroid hormone production, or insulin resistance. Instead, it moves directly to its therapeutic claims. Whenever a single intervention is claimed to work for conditions that arise through completely different mechanisms, it is worth asking an important question. What exactly is the evidence? The textbook assures the reader that there is current research evidence. Excellent. But where is it? There are no clinical trials, no authors, no journals, no patient outcomes, no references that allow a student or anyone else to verify the claim. In science, that is a problem. Imagine reading a textbook that says NASA has proved this, but never tells you which mission, which experiment, or where the data can be found. That is not evidence. That is an invitation to blindly believe the author. And this distinction matters because therapeutic vomiting isn't risk-free. Repeated vomiting can lead to dehydration, electrolyte imbalance, tears in the esophagus, and in some cases, aspiration pneumonia if stomach contents enter the lungs. Every medical treatment involves weighing benefits against risks. If the benefits are large enough, the significant risk may still be justified. Chemotherapy is a good example. But if you're asking people to accept those risks, the evidence needs to be equally convincing. That is the part that is missing here. The mechanism rests on an analogy. The list of diseases continues to grow, but the evidence never quite catches up. As you'll see, this becomes a recurring pattern throughout the textbook, and the next chapter takes that pattern somewhere I honestly wasn't expecting. It isn't about treating adults, it is about treating newborn babies. The second procedure is Virechana, therapeutic purgation. Where Vamana is intended to eliminate vitiated kapha through the mouth, Virechana is said to remove vitiated pitta through the bowels. The underlying principle remains the same. Disease is explained as something that can be expelled by eliminating an invisible imbalance. The textbook then recommends the use of castor oil in newborn babies to prevent physiological jaundice and a condition known as meconium ileus. Although they appear together on the page, these conditions have very little in common. Physiological jaundice is extremely common during the first days of life as the newborn's liver matures. In most babies, it resolves without treatment. When intervention is necessary, modern medicine uses phototherapy, where carefully controlled blue light helps the body break down excess bilirubin. Meconium ileus is an entirely different condition. It is an intestinal obstruction, often associated with cystic fibrosis, in which the baby's first stool becomes so thick that it blocks the bowel. Left untreated, it can become a surgical emergency. Both the conditions mentioned here are as similar as a mild traffic jam and a collapsed bridge. One condition is usually self-limiting, the other may be life-threatening. Yet, the same recommendation is offered for both. And when two completely different diseases are assigned the same treatment, the burden of evidence becomes much higher. So what evidence does the textbook provide? Unfortunately, very little. There are no clinical trials, no safety data in newborns, no discussion of dehydration or electrolyte imbalance, and no explanation of why two fundamentally different conditions should respond to the same treatment. The recommendation simply appears as established knowledge. The explanation that follows relies on another analogy. Just as pouring water into a fire extinguishes the flames, removing excess pitta is said to eliminate diseases associated with it. Again, it is easy to understand because all good analogies are. But medicine has an awkward habit of asking one more question. Is the analogy describing reality or just helping us imagine it? Inflammation isn't literally a fire. The bowel isn't a drain pipe for excess disease. And emptying the intestine doesn't automatically explain why a disorder somewhere else in the body should improve. An analogy helps us picture a mechanism. It isn't the mechanism itself. The textbook then expands the claims even further. Virechana, we are told, doesn't just treat disease. It sharpens the intellect, improves the senses, and slows down aging. Now here is the interesting part. These are actual claims that science can investigate. You can measure memory, you can test sensory function, you can study biological markers of aging. None of these are beyond the reach of modern research. So this isn't a situation where science says we have no way of knowing. Science says show us the data, and that is precisely what is missing. The textbook doesn't present clinical studies showing improved cognition. It doesn't measure sensory performance before and after treatment. It doesn't compare aging outcomes between treated and untreated groups. The claims are presented, evidence isn't. The next chapter introduces another concept. At first, it seems straightforward. Then, halfway through, the definition quietly changes. And that turns out to be far more interesting than it first appears. The third procedure is Basti, traditionally described as the primary treatment for disorders caused by Vata. In classical Panchakarma, Basti refers to medicated oils or herbal decoctions introduced through the rectum. The idea once again is that restoring the balance of one dosha restores health. So naturally, the first question is, how does medicated oil pushed through Uranus help fight diseases? Then the chapter does something completely unexpected. The word Basti starts appearing in places where there is no enema. There is Griva Basti for the neck, Kati Basti for the lower back, Janu Basti for the knee, Hridu Basti for the chest. In these procedures, warm oil is simply held against the skin using a door ring. Nothing enters to the rectum. Nothing leaves the body. At this point, I had to stop and reread the chapter because the definition had quietly changed. Basti began as an enema. Now it is also a pouch of warm oil sitting on the skin. Same name, completely different procedure. Imagine reading a cookbook where baking starts off meaning put food in an oven, but halfway through the book also includes deep frying. This also raises a biological question. Oil retained over the chest is recommended for chest pain. Oil retained over the knee is recommended for arthritis and ligament injuries. The obvious question is diagnosis. Chest pain is not a disease but a symptom. It may result from a strained muscle, acid reflux, pneumonia, inflammation around the heart, or a blocked coronary artery causing a heart attack. These conditions have entirely different causes and require entirely different treatments. The same is true for the knee. Arthritis may arise from inflammation, degeneration of cartilage, or autoimmune disease. A torn ligament is a structural injury requiring a different approach altogether. But there is no mention in the textbook as to how the oil is going to help fix the underlying problem. How exactly is the medicine entering the body? Modern pharmacology has spent decades studying drug delivery through the skin. Human skin is remarkably good at its job. Its main purpose is to keep things out. That is why you don't absorb soap into your bloodstream every time you take a shower. Only a relatively small number of carefully designed molecules can pass through intact skin in therapeutically useful amounts. In pharmacology, there is even a useful rule of thumb called the 500 Dalton rule. Without getting into too much chemistry, molecules larger than roughly 500 Daltons generally struggle to cross intact skin. That is why transdermal patches work only for a fairly small number of drugs like nicotine, fentanyl, or estrogen. They are specifically chosen because their chemistry allows them to cross that barrier. Herbal oils are very different. They are complex mixtures containing hundreds of compounds, many of them far larger than the kinds of molecules normally used in transdermal medicine. Could a few small molecules be absorbed? Certainly. Essential oils can penetrate the skin to some extent. That is well established. But that is a very different claim from saying the treatment reaches deep tissues and connects the underlying disease process. The textbook never explains how that leap happens. Then there is another detail that caught my attention. Treatment duration isn't measured in minutes. It is measured in matra. A matra is traditionally described as the time taken for a blink, or according to some classical texts, a single breath. Neither is a fixed unit. People blink at different rates. Breathing changes with age, exercise, anxiety, and even when we are talking. Yet treatments are prescribed with remarkable numerical precision. 6,000 matras, 8,000 matras, 10,000. Precision creates an impression of accuracy, but only when the unit being measured is itself reproducible. If a unit varies from one person to another, increasing the number of units does not make the measurement more objective. Perhaps that is the more revealing pattern in this chapter. Not simply that the therapeutic claims are broad, but that the definitions themselves become increasingly flexible. A procedure that begins as an enema gradually expands to include treatments performed entirely on the surface of the body, while an imprecise measure such as a blink becomes the basis for apparently exact prescriptions. And that is worth keeping in mind as we move to the next procedure, because now we arrive at perhaps one of the most fascinating claims in the entire textbook. Remember the treatment I mentioned at the very beginning? The one involving medicated oil placed inside the nose? This is where it appears. The procedure is called Nasya. The textbook describes the nose as the gateway to the head. The nose is certainly close to the brain, but being nearby doesn't make it a doorway. Simply putting something into the nose doesn't mean it enters the brain, any more than putting eye drops in your eyes means they will reach your visual cortex. However, the textbook claims that medicines administered through the nose are said to travel into the structures of the head, identify the disturbed dosha, and remove it. It's an elegant idea, and interestingly, modern science has asked a somewhat similar question. Can medicines reach the brain through the nose? The answer is, in principle, yes. But the story is much more interesting than a simple yes or no. Your brain is protected by one of the most sophisticated security systems in biology. It is called the blood-brain barrier. Think of it as an extremely selective immigration checkpoint. Most molecules are turned away. Only certain substances with the right properties are allowed through. This is wonderful if you're trying to keep toxins out of the brain. Less wonderful if you're trying to deliver medicines into it. That is why neuroscientists have spent decades exploring whether the nose could provide an alternative route. Some nerves inside the nasal cavity connect directly with the brain. In theory, they might allow certain drugs to bypass parts of the blood-brain barrier. Notice the wording, certain drugs, not all drugs, and certainly not all herbal oils. And there is another thing that prevents nasal treatment. The nose is designed to keep foreign substances out. Mucus traps the particles, cilia sweep them away towards the throat, and many molecules are simply too large or possess the wrong chemical properties to cross the nasal lining efficiently. Even molecules that do enter the nasal tissue must still overcome additional biological barriers before reaching the brain. That is why modern intranasal medicines require carefully engineered formulations, and why reliable nose-to-brain drug delivery remains a major challenge despite decades of research. It is difficult, which makes the textbook's explanation all the more interesting. The textbook doesn't discuss molecular size or pharmacokinetics or whether the active ingredients can even cross the nasal lining. Instead, we are simply asked to accept that medicated oil enters through the nose, finds the disturbed dosha, removes only that dosha, and leaves everything else untouched. If you think about it, that is actually several separate claims rolled into one. That the medicine reaches the brain, that it reaches it in sufficient quantity, that it can identify a particular dosha, and that removing this invisible entity treats disease. Each of those claims would require evidence. The textbook doesn't provide any of it. Instead, it turns directly to the diseases that Nasya is set to treat. The list begins with headache, neck stiffness, and sinus disease before expanding to tetanus and tumors. These are not variations of the same illness. Tetanus is an acute bacterial infection caused by Clostridium tetani. Its toxin attacks the nervous system, producing several muscle spasms that can interfere with breathing. Tumors present a different challenge altogether. They're not a single disease, but hundreds, each requiring treatment based on its tissue of origin and biological behavior. Surgery, radiotherapy, chemotherapy, immunotherapy all have a role depending on the diagnosis. Yet, the Ayurveda textbook presents these conditions side by side, recommending the same procedure for all of them. Pour oil through the nose. One thing I genuinely appreciated about this chapter is that it's surprisingly detailed about when not to perform Nasya. The rules are detailed and carefully described, but they all assume the treatment works. They don't answer the question that matters most. Has it been actually shown to help patients? That question has followed every procedure in this video. It also leads naturally to the final chapter, one devoted to a treatment once accepted by medical traditions across much of the world before evidence gradually brought it to an end. The fifth and final procedure is Raktamokshana, or bloodletting. It is also one of the oldest medical practices in human history. Long before bacteria were discovered, before the circulation of blood was understood, and centuries before medicine began testing treatments through controlled clinical trials, physicians across much of the world believed that many diseases could be treated by removing bad blood from the body. The practice was not unique to Ayurveda. It formed part of Greek, Roman, and medieval European medicine, and for centuries it was regarded as entirely rational. Today, it does not belong to clinical medicine, but to the history of medicine. One of its best known examples occurred in December 1799. George Washington, the first president of the United States, developed what was probably an acute throat infection. His physicians, among the most respected of their time, treated him according to the best medical knowledge then available. During a single day, they removed nearly half his blood volume through repeated bloodletting. Washington died later that evening. Whether bloodletting alone caused his death can never be known with certainty. His illness was already severe, but historians of medicine generally agree that removing such a large proportion of his circulating blood almost certainly reduced his chances of survival. The important lesson is not that Washington's doctors were incompetent. They were practicing what their profession regarded as good medicine. What changed was the evidence. As physiology advanced, inherited authority gradually gave way to observation and experiment. Bloodletting repeatedly failed to demonstrate the benefits once attributed to it, and one of the oldest treatments in medical history slowly disappeared from mainstream medical practice. Now let us return to the textbook. Here, bloodletting appears not as an abandoned medical practice, but as a living therapeutic procedure explained through the theory of the doshas. Interestingly, there is one very specific situation where modern medicine uses a form of leech to perform a kind of bloodletting. It is a fascinating story. I'll cover that in a separate video if needed. Look, I'm sure you all have come to the same conclusion as I have. Every chapter in the textbook begins with confidence. Then comes an explanation, usually illustrated with a memorable analogy. Then follows a surprisingly wide range of diseases that the treatment is set to address. But somewhere between the explanation and the conclusion, one crucial ingredient keeps going missing: evidence. Some herbal compounds may eventually prove useful, just as aspirin came from willow bark and artemisinin came from traditional Chinese medicine. Science has never rejected ideas simply because they are old. In fact, science has happily adopted thousands of old ideas, just not on belief, on evidence. That is an important distinction. Evidence-based medicine isn't a collection of Western treatments competing with Eastern treatments. It is a method, a way of separating treatments that genuinely help patients from treatments that merely sound convincing. And that process has no respect for geography, culture, or history. It becomes more or less credible depending on how well it survives careful testing. That is the standard every medical claim should meet. Doesn't matter if it comes from a pharmaceutical company or a 2000-year-old manuscript. And that brings us back to the question we began with. Do these Panchakarma procedures withstand that standard? After reading the books, examining the mechanisms they propose, and comparing them with what modern biology has discovered, I don't think they do. Not because they're ancient, but because the evidence needed to support these extraordinary claims is still missing. By now, we have seen many explanations of how these treatments are supposed to work, but we still haven't seen the scientific evidence needed to show that they really do. In the upcoming episodes in this series, we will look at other forms of treatment by reading from the text itself. Medicine advances by testing its ideas against reality. Some withstand that process, many do not. Panchakarma could fall into either category. Like every medical claim, it can only be answered in one way, with empirical evidence. And so far, Panchakarma draws a big blank there. I hope you like this episode and the series. Please do the usual like, comment, hype and share so that this video reaches more people. And you shall see me in the next one.